Thank you all for coming. We have an informational 2 hours planned for you with our panel of local experts. To introduce our speakers, starting from the right, this is Dr. Paul Pettay. Dr. Pettay is a chiropractor with Siegenthaler Center. He works with numerous professional and semi-professional teams and athletes. Next, Dr. Vollmar. Dr. Vollmar is a primary care sports medicine physician at Diamantoni Associates family practice. He's the team physician for several Lancaster school systems and the PIAA. Next to him is Dr. Beiler. Dr. Beiler is a physical therapist at Drevna Physical Therapy Associates. He works with athletes specializing in shoulder rehabilitation and ACL injury prevention. Next, we have Dr. Horning. Dr. Horning is an orthopedic surgeon at Orthopedic Associates of Lancaster. He's also a team physician for the Lancaster Barnstormers. Next is Mr. Quigley. We also know him as Quigs here at Manheim Township. He is an athletic trainer here at Manheim Township School District. Next, we have Mr. Longenecker. He is an admissions counselor at Pennsylvania College of Health Sciences. Now our speakers will each give an overview of their fields, and then we will open the floor for questions. At each of your tables is some note cards and pens. If you have any questions while they're speaking, just write them down and we'll open the floor for questions at the end.
I'm a chiropractor. I've been a chiropractor for 19 years. My office is inside a Universal Athletic Club. I'm fortunate to work with a lot of different sports injuries and a lot of different athletes at various ages and levels. I went to New York Chiropractic College, which is in Seneca Falls, New York. There's 13 accredited chiropractic schools in the U.S. and there's 2 in Canada. I am Canadian, so you can hear a couple of A's or abouts. That's where you know that's coming from. I am a U.S. citizen. So when you go to chiropractic school, it's 3 1/3 years straight through. Your educational requirements are that you have a minimum of 3 years of college. You can get into some schools after 2 years of college with a science background. However, most states now are requiring that you have, at least a 3-year, or making an that you have a 4-year degree. So it's a really good idea to get a 4-year degree and then apply if you're interested in chiropractic. On top of our chiropractic training, we're taught to treat musculoskeletal injuries using either chiropractic adjustments or manipulations to realign the spine. The second thing we do is a lot of soft tissue work. We're trained to manually treat different soft tissue injuries. We're also allowed to use different therapies, heat, stim, ultrasound, laser, whatever we can choose to do. Typically, chiropractors work for themselves. That's one unique thing about our profession. There's really not any large groups or hospital settings. Most guys have opened up their own practices on their own. So in my case, my business partner and I opened up 19 years ago. We graduated together from school, moved to the area, and just decided we were going to open up here. So that can be tough and it can be challenging doing that rather than going into an established practice or a hospital setting. But it's one unique thing about chiropractic. Our office is specialized into some different techniques. So we do a manual therapy technique called active release techniques. We also do a Braxton technique, which is the stainless steel tool that does some scraping. So there's a lot of stuff that in chiropractic you're going to do post-educational from your degree. And there's really a lot of flexibility to specialize in whatever areas you want. I never really thought that I would be in a sports type of situation. However, being in a health club and then different opportunities that I've had over the years, it's been a unique experience. And so we were able to then focus on more sports-related type injuries. Finally, I've been really blessed with my opportunities. I've worked with Rishi Bears for the past 10 years. Being a Canadian, I got to be around hockey. We've been able to win 3 Calder Cups in those 10 years. We were in the finals 5 of those 10. I've worked independently for many NFL players, NHL players, Major League Baseball, Major League Soccer, and lacrosse. And it's been a blast. It's really a fun experience to get to know the guys and to work in those situations. And finally, I worked with a KHL hockey team that came over to train at one of the training settings that I work at, and I worked with them for 2 summers. So that's interesting working with different cultures, different ethnicities. I've worked with professional dancers, musical entertainers, anybody that goes through Hershey Park. I've had opportunities to treat different people through there, which has been neat. And then also just treating college, high school athletes at different levels, at different sports, and we basically run the entire gamut of sports. So it's been a really great opportunity, and I love what I do. And that's the one thing that I would say to you is that if you talk to most chiropractors, they really love what they do, and that's really the key of to finding what you want to do career-wise. Thanks.
Hi, I'm Bill Vollmar. I'm a family practice doctor with Diamantoni Associates. And in primary care sports medicine, what we do is we take a primary care physician training and then add on top of that our sports medicine training. So, like most of the people here, we're going to have college educations and then so many years of medical school, which is usually 4 primary care residencies, which are residencies like in family practice and pediatrics, emergency medicine, primary care, internal medicine, are usually 3 or 4 years after medical school, and then your sports medicine fellowship is 1 to 2 years after that. So it's a real good way to avoid the real world for an extended period of time. Our jobs are unique in the sense that we tend to be the first people next to the athletic trainers to get to evaluate the athletes, and then if we have something we can do for them, we take care of them, but oftentimes we're then getting our athletes out to the rest of these guys to help with specialty care, whether it's surgery or therapy or manual therapy, to get them taken care of. But we also differ in a little bit that we are primary care physicians, so we're involved in healthcare with a lot of these people. At the professional level, primary care doctors that do that in sports medicine are often not only taking care of the athletes, but taking care of their families as they're traveling with teams and stuff like that. College level, they're often taking care of not just the athletes in college, but all the other students as well with just primary health care. And my way of doing it in private practice, I have 40% of my patients are traditional family practice patients, 60% are my athletes, and yet it's all overlapping in terms of healthcare. Healthcare in that sense is athletes with high blood pressure, with diabetes, managing concussions, managing asthma, stuff like that, as well as those soft tissue injuries and stuff that we can handle at our level. So it's a neat crossover of how we cover things. It's a nice area to really niche yourself. I tend to work predominantly with high school and college athletes, being training room hours at the schools that we cover, going and seeing people on a weekly basis, having office hours where people come in. And so it's a unique area. I think the part of this that I like the best is the fact that I'm now taking care of the children of athletes I took care of 15, 20 years ago. And so I get to see growth not only with kids, but growth with families and changes over time. And that's really exciting for me to follow. Sometimes we see our fields going through technical changes, so I like to keep up with those things. We're getting into musculoskeletal ultrasound for evaluation and for helping us do procedures. So there's always something new coming along. So it's one of those things where you're never ever going to stop learning. You kind of keep pushing forward and staying on the edge of the technology, on the edge of the knowledge. Because in our world, a lot of what we've done in the past, for all of us, is based on tradition, not based on a lot of pure science. And we're starting to just get into the ability to prove pure science applications for the things that we're doing. So that's a neat part of what we do.
All right, I'm Mike Beiler, a physical therapist. Our end in the sports world is oftentimes dealing with the injuries. You see these guys, the trainers first, and then we'll see you guys afterwards if they can't fix you. The education background for myself, I have a biology degree, 4 years of college for that. Then I got my master's degree at Manheim University Hospital in Philadelphia, and that's 2 years full-time for the summer. And then my doctoral degree is from Temple University. But the schools nowadays, the way they're set up, you can do PT school in 1 of 2 ways. You can do 4 years of college and then 3 years of graduate school. there's no such thing as a master's degree anymore. It's all doctoral level, so you need 3 years of graduate school. But there are some schools that do what they call a 3+3 program, where you go into the college, do 3 years of undergrad work, it's condensed, and then they do 3 years of undergrad work on top of that, and you graduate with a doctoral degree. What we do on a daily basis is we're more movement specialists. We're the guys that, you come and say this hurts, we'll try to help you figure out why. Sometimes with athletes, you have injuries that are bad enough that you have to go on to see a physician or hopefully not a surgeon, but sometimes it comes that way. But we do our jobs right, we can keep you from seeing those guys. There's 2 ways that people usually come into our office. We do have in Pennsylvania what's called direct access, which means if you get hurt and you say, you know what, I don't think I want medication, I don't think I broke, I don't need an x-ray, I don't think I want to do any of that kind of stuff, I just want to get fixed. You can come straight to us without having to see a physician. But if you think it's a bad enough injury, then you know what, I really want to get this double checked, you go see Dr. Vollmar or Dr. first. So a lot of our practice is referral based. We get patients coming from the physicians that have seen them either through the school or we go to their office and they come see us. But when an athlete comes in, we get to see them through a large span. We'll see them 2, sometimes 3 times a week. So we get to know you guys really well, and I have a couple of guys floating out here that have seen me. And we take you from, hey, I'm really hurt, I can't move, I have to stop playing my sport, I'm really bummed out, go through the healing, go through the strengthening, stretching, whatever we need to do to get you back to the field of action. And in our office, you'll see people doing push-ups, we'll have them doing sprints, jumping, cutting, all those things that you need to do to get back into the sport. And we do very sport-specific design programs. Like, if you're a wrestler, we're not going to necessarily have you jumping a lot. But if you're a tennis player, you're going to be running and cutting, maybe do some jumping. We've seen volleyball players. What's fun sometimes too is, as Dr. Vollmar was saying, you get to see people coming back to you year after year. So I've seen some kids I treated at high school level that go on to play that in college. And I just saw a girl just this week, she's at USC, she's a Division I rower at USC, got hurt out there, was home on break, didn't want to miss her therapy that she started there, saw her for a week, she's on a plane today, back to USC. So you get to see some of those hard athletes too. But mostly here in Lancaster, it's high school level with the spattering of college people coming to see us. But again, like our chiropractor friend was saying, it's fun. We get to have a good time during the day. The patients and the guys that I can see too, which I have any names to keep privacy. But we have fun there, and it's a good time. You get to know your people really well. You develop friendships, and you get to see people for many years to come. One thing that these guys didn't talk about, I guess, our host asked me to talk about, was starting salaries. In Pennsylvania, for physical therapy, again, any school you go to now, it's going to be a doctoral level, so you'll have at least 6, if not 7 years of schooling, and you can expect to start somewhere about $60,000 to $65,000 a year to start. And then once you get your years of experience, I did some light research for this, you can expect to see somewhere between $80,000 to $90,000 a year with 10 to 15 years of experience. If you own a private practice, you can earn more than that. That's going to be a lot more time out of your week. Private practitioners that I know work about 60 hours a week. I work 40 to 45 hours a week, and we keep busy.